Let's discuss the Chinese medical theory, the holistic concept. Advocates of TCM approach readily acknowledge the overwhelming superiority of Western science and modern medicine in unraveling the microbiological mechanism by which disease affects physiological processes, as well as the drugs that destroy hostile pathogens and rectify cellular disorders. The TCM approach is to look at underlying conditions, the imbalances, that allow the pathogens to take hold or the cellular disorder to arise. TCM could be deemed as looking at the health of the human body holistically from above, while Western medicine looks at it from below, at the level of cells, genes, and microbiological agents. This is, of course, not a fair characterization of Western medical principles, which also encourage looking at the patient's body as a whole rather than just his or her blood tests and x-rays. But the reality is that Western medicine has been spoiled by great advances in diagnostic technology. So doctors tend to rely more on laboratory tests than on observing of symptoms presented by the patient on examination. The role of the family physician or the general practitioner has also declined relative to that of the specialist. TCM has only direct visual and tactile observations and the patient's description of how he feels on which he relies. To rely, hence being holistic, is its only choice. Chinese diagnosis relies on directly observable symptoms presented by the patient, including the patient's own detailed description of how he feels, then proceed to draw conclusions on how the body's condition has deviated from that of a healthy and balanced state. Therapy consists of bringing the body back to the balanced state, like the umbilicus wooden wheeled cart pulled by a bullock in ancient China. Chinese medicine is technologically primitive. Like the bullock cart, it is crude and slow, but sometimes gets the job done. Occasionally, perhaps it even takes you through dirt tracks and hilly terrain that the BMW cannot handle. Chinese medicine invented relatively simple models of the human body and of disease causation. It has applied these models in complicated ways to handle a wide variety of illness using experience that physicians gained over its long history. That many people were healed when these methods were applied should not be in doubt. What can legitimately be asked is whether they were healed by the methods applied. Would the same number have been healed anyway if nothing had been done? Close to 100% of common colds healed with no medical treatments. Even if the answer to this question is no, meaning that there are some patients who are healed by Chinese medicine who would not have been healed if nothing had been done, it can still legitimately be asked if the therapeutic gain was caused by something specific to the TCM treatment rather than by a placebo effect. Hence, there is ultimately a need to put TCM therapeutic methods to the test through clinical trials. Reconstructing TCM theory. Attitudes towards TCM are virtually polarized into two camps, the believers and non-believers. Most TCM practitioners belong to the first camp. Most Western doctors belong to the second group, although typically, while rejecting TCM theory, some observe that TCM interventions may produce therapeutic results, a point conceded even by one of the alternative medicine's sternest critics. Many Western doctors now also believe in and practice acupuncture as a method of pain relief without necessarily accepting TCM theory's explanation for its efficacy. For example, the Singapore Health Ministry recognizes a one-year part-time course to qualify Western doctors for the practice of acupuncture in their clinical work. These doctors learn to needle various acupoints for symptomatic relief of conditions such as pain, dizziness, and insomnia. Few of them believe that ancient Chinese theories that attempt to explain the therapeutic mechanism of acupuncture. TCM faces legitimate challenges by Western science on two counts. First, many of its core concepts like chi meridians and phlegm sound like meaningless or, at any rate, metaphysical entities, ill-defined and mostly not measurable and even unobservable. Second, the model used in TSM theory are mostly untested. It has also not been generally made clear that they are testable. Thank you for your attention.
Now let's discuss interviewing by age or gender. Knowing the age and gender of a person already gives us an idea of what imbalances are probable, and thereby which signs and symptoms we should look for. This is because there are specific physiological factors that affect the respective genders and people of different ages. There are also certain lifestyle and emotional influences that are more relevant to specific genders and age groups. These are, of course, only probabilities and are definitely not certainties. This is because even though a person's age and gender will predispose them to certain imbalances, there are a great many other factors that will also have had an influence that may have resulted in completely different imbalances. Women lose blood when they menstruate and when they give birth. This means that they have a tendency to develop not just blood deficiency, but also spleen qi deficiency, because the spleen will have to generate good qi constantly to help replenish the blood that has been lost. This constant demand on their spleen will also lead to their Mingmen becoming weaker, especially when they are 35 and enter the fifth Jing cycle, where there is a natural decline in strength of the Mingmen. This will manifest with an increased tendency to dampness and phlegm. This is the reason many women's bodies become more pear-shaped at this age. When a woman is 49 years old, her yin and blood will be so depleted that she will enter menopause. This means that patterns of blood deficiency and yin deficiency heat are more probable from this age onwards in women. As stated, it is very important to be observant of other possible patterns. Women's tendency to blood deficiency means that women may also manifest with liver qi stagnation. This is because blood helps to moisten the liver and make it flexible. Furthermore, women's position in society and the expectations placed on modern women in terms of having a career whilst being a good mother, looking after the home, trying to look good and having an active social life can all help to create a sense of frustration that will stagnate her liver qi. Young men tend more towards excess heat, especially in the liver and stomach, because young men are more yang in general, but also due to their lifestyle, where a higher intake of alcohol is more likely than in women and older men. As written, these examples are only broad generalizations, and many people do not necessarily fit into these descriptions. Teenagers tend to develop excess heat. The reason for this is that their Mingmen flares up during this period. This creates heat in various organs. Heat in the stomach can manifest in their appetites. Most people have experienced a 16-year-old boy's insatiable appetite, and in their skin, where the heat in the stomach and damp heat will mean that they are prone to acne. The increased heat from Mingmen will also affect their mood. This is because the heat will agitate the liver and heart, making them more hot-tempered and moody. Their libido is also relatively high due to the increased heat from the Mingmen. Babies and small infants tend to develop food stagnation. This is because their stomach and spleen are not fully developed yet. The stomach and spleen are first fully developed from about the age of 7. This means that babies find it difficult to transform and process the food that they consume. One must therefore be careful of what they are given to eat, how much they are fed at a time, and how often they are fed. This also, of course, applies to older children, but it is especially relevant for infants. Many disorders that affect babies and toddlers will relate to their tendency to develop what is known as accumulation disorder and the patterns of imbalance that this can engender. Because children's yin is not strong, they tend to degenerate pathological heat, especially when they get ill. When they are affected by qi, they will quickly develop a high fever because their yin is not capable of controlling the heat. This is also seen in the evening when they are tired. When their yin cannot control yang in the evening, they become overexcited and restless, and their cheeks become red and flushed. The older people get, the more they become both yin deficient and yang deficient. This is because their kidney jing becomes continuously weaker, and the kidneys are the root of all yin and yang in the body. However, this is not the whole story. It is because kidney yin deficiency and yang deficiency will undermine other organs and these organs' production of the vital substances, resulting in a tendency to qi deficiency and blood deficiency. At the same time, there is also an increasing tendency to develop stagnations of qi, blood, and phlegm the older one gets. This can be clearly seen in the body movements of older people. There is not only a lack of strength, but also a lot of stiffness in their movements. Their skin will often manifest signs of blood stagnation, with many spider nevi, visible purple blood vessels, and liver spots. Some Chinese medicine doctors also believe that there is an increasing accumulation of pathogenic heat retained inside the body as people get older. This is because each time there has been a pathological invasion of pathogenic factor, there will remain a residue of the pathogenic factor in the body. These residues of pathogenic factor will accumulate, creating heat and stagnating the vital substances. This is one of the theories behind the development of age-related cancer. Thank you for your attention.
Let's continue with the Yin-Yang 4 principles and its application to medicine. I will talk about redness and paleness. A red complexion indicates excess of yang or deficiency of yin. A pale one, excess of yin or deficiency of yang. Restless versus quiet. Restlessness, insomnia, fidgeting, or tremors indicate excess of yang. On the other hand, quiet behavior, desire to be immobile, or sleepiness indicate excess of yin. Dry versus wet. Any symptom or sign of dryness, such as dry eyes, dry throat, dry skin, or dry stools, indicates excess of yang or deficiency of yin. Any symptom or sign of excessive wetness, such as watery eyes, runny nose, damp pimples on skin, or loose stools, indicates excessive yin or deficiency of yang. Now, hard versus soft. Any lumps, swellings, or masses that are hard are usually due to excessive yang, whereas if they are soft, they are due to excessive yin. Excitement versus inhibition. Whenever a function is in a state of hyperactivity, it indicates an excess of yang. If it is in a state of hyperactivity, it indicates excess of yin. For example, a rapid heart rate may indicate excess of yang of the heart, whereas a very slow heart rate will indicate excess of yin of the heart. Rapidity versus slowness. This shows in two ways: in a person's movements and in the onset of the manifestations. If a person's movements are rapid and he or she walks and talks fast, it may indicate an excess of yang. If a person's movements are slow and he or she walks and talks slowly, it may indicate an excess of yin. If symptoms and signs appear suddenly and change rapidly, they indicate a yang condition. If they appear gradually and change slowly, they indicate a yin condition. Now, substantial versus non-substantial. As explained earlier, yang corresponds to a subtle state of aggregation, and yin corresponds to a dense, coarse state of aggregation. If yang is normal, things will be kept moving. Qi will flow normally and fluids will be transformed and excreted. If yang is deficient, qi stagnates, fluids are not transformed or excreted, and therefore yin will prevail. Thus, yang keeps things moving and in a state of fluidity or non-substantiality. When yin prevails, the movement and transformation power of yang fails. Energy condenses into form and it becomes substantial. For example, if qi moves normally in the abdomen, the intestine's function of separation and excretion of fluids will be normal. If yang fails and qi decreases, the yang power of moving and transforming is impaired. Fluids are not transformed, blood is not moved, and in time, the stagnation of qi gives rise to stasis of blood, then to actual physical masses or tumors. Thank you for your attention.
Let's discuss the extraordinary yang organs, the uterus relationship with spleen, liver, and stomach. First, the spleen. The spleen is the root of post-heaven qi, and it is the source of qi and blood. As it is the source of blood, it plays a role in relation to the uterus and menstruation. However, this role is secondary to that of the kidneys because the latter are the origin of menstrual blood, Tiange, and the spleen plays only a secondary role in supplementing that blood. In other words, menstrual blood is not white blood, but a precious fluids equivalent to sperm in men that derives directly from the kidney essence. Next, the liver. Menstruation, conception, and pregnancy depend on the state of the blood upon which the uterus depends. The functional relationship between uterus and blood is very close. The uterus relies on abundant supply of blood at all times. Since the heart governs the blood, while the liver stores the blood and the spleen controls the blood, these three yin organs are physiologically related to the uterus. But the liver is clinically the most important one. For example, if the liver does not store enough blood, the uterus is starved of blood, and this may cause amenorrhea. If liver blood is stagnant, this will affect the uterus, causing painful periods with dark clotted blood. On the other hand, if the spleen cannot produce enough blood, the heart blood becomes deficient, the uterus may lack blood, resulting in amenorrhea. If the blood stored by the liver is hot, this may cause the blood in the uterus to flow out recklessly, causing menorrhagia or metrorrhagia. If the liver qi is stagnant, this may cause liver blood stasis, which in turn will affect the blood of the uterus, resulting in painful periods with dark clotted blood. In practice, the relationship between the uterus and the liver blood is extremely important and one which is very apparent in many pathological conditions. Because the liver stores blood and regulates the volume of blood, menstrual irregularities are often due to a dysfunction of the liver. For example, liver qi stagnation often causes irregular periods. Liver blood stagnation often causes painful and or irregular periods. Liver blood deficiency may cause scanty periods or absent of periods. Next, the stomach. Among the yang organs, the uterus is closely related to the stomach. This connection is via the penetrating vessel, the chongmai. This vessel is closely related to the stomach and also flows through the uterus, thus providing a link between the uterus and the stomach. Morning sickness during pregnancy and the nausea or vomiting which some women experience during menstruation are often caused by disruption of the stomach with rebellious qi because of changes in the penetrating vessel in the uterus. So the relationship between the uterus and the internal organs, the summary. The kidneys are the origin of menstrual blood. The heart governs blood. Heart yang meets kidney essence to form tiange. Heart qi descends to promote discharge of menstrual blood and eggs. Heart qi descends to trigger transformation of yang to to yin and vice versa in menstrual cycle. The liver stores blood which fills the uterus. The spleen makes blood which supplement yang. The stomach is related to the uterus via the penetrating vessel. So we have here the illustration relationship between the uterus and the internal organs. So from the heart, this promotes transformation of yin and yang, the bangmai going to the uterus. Next, the liver, it provides blood. Then the kidneys provides essence and minister fire, the baulu. The spleen makes blood. The stomach via Chong. Renmai provides yin. Chongmai moves blood. And Dumai provides yang. Thank you for your attention.
We continue with treatment principles, the root and manifestation. Before reporting the case history for this episode, we should discuss briefly the pathology of severe metorrhagia, which is defined as heavy and irregular menstrual bleeding, called penglu in Chinese medicine. There are two basic causes of heavy and irregular menstrual bleeding. Either deficient qi fails to hold blood, which leaks out, or heat in the blood pushes the blood out of the vessels. In the first case, heavy bleeding will be accompanied by general symptoms and signs of qi deficiency, such as tiredness, pale face, shortness of breath, poor appetite, loose stools, pale tongue, and empty pulse. When bleeding is due to blood heat, there will be general signs of heat, such as a red face, a feeling of heat, thirst, insomnia, a red tongue, and a rapid overflowing pulse. A 36-year-old woman had been suffering from chronic menorrhagia. The bleeding was so irregular and constant that some months she did not know when her period occurred, as she was bleeding every day. She presented with general symptoms of qi deficiency, such as a pale and sallow complexion, tiredness, a weak voice, loose stools, and a weak pulse. It was therefore concluded that the bleeding was due to qi deficiency, and she was treated by tonifying qi. This produced no results. The diagnosis was reassessed and was discovered that she often felt thirsty, her cheeks were occasionally flushed, her tongue had a slight redness on the sides, and her pulse was very slightly rapid. It was therefore concluded that the original diagnosis was wrong and that the bleeding was actually due to blood heat. When the treatment was changed by cooling blood, this produced immediate results. If the bleeding was due to blood heat, what are we to make of her qi deficiency symptoms? What had happened was that the qi deficiency was actually the result rather than the cause of bleeding. In cases of heavy prolonged bleeding, the chronic loss of blood induces a deficiency of blood. As blood is the mother of qi, this will eventually induce a qi deficiency. In this patient's case, therefore, qi deficiency was a manifestation rather than a root, as follows. So, bleeding causes blood deficiency, that is the manifestation of the blood deficiency. Then blood deficiency causing the qi deficiency, that is manifestation of the qi deficiency. Why do we need to identify the root? In the course of a disease, the clinical manifestations can be very numerous and complicated, and sometimes contradictory. Different clinical manifestations will appear and develop in the course of a long chronic illness. They may combine with superseding acute symptoms. Interior conditions may overlap with exterior ones. Deficient conditions may coexist with excess ones. Cold can coexist with heat, and so on. Identification of the root, which need not be a single one, but could be a multiple one, allows us to understand and unravel the numerous clinical manifestations to see the underlying pattern and decide on the principle of treatment according to the condition of the patient and the character of the diseases. There is a saying in Chinese medicine, to treat a disease, find the root. This succinctly summarizes the importance of always tracing the clinical manifestations back to their root in order to treat a disease. This is because, generally speaking, the root is the primary aspect of the contradiction. That is, it is generally primary in relation to the clinical manifestations. As the root is primary, treatment of the clinical manifestations is usually carried out by treating the root. Thank you for your attention.
Let's continue our discussion with diagnosis according to Zhang for organ patterns. Today we discuss lung wind heat invasion. Invasion of wind heat, like wind cold, is usually an acute pattern, while an invasion of wind cold will often, but certainly not always, arise from climatic influences such as cold or drafts. An invasion of wind heat can be caused by exposure to climatic influences and also by infectious pathogens such as bacteria and viruses. Where wind cold invades the body via wind chi in the skin, wind heat can also invade the body by the mucous membranes in the nose and mouth. Again, allergens and other influences from the outside of the body can give rise to a wind heat reaction, and as described earlier, it is the symptoms and signs that define the pattern. What's the wind heat etiology? It's exposure to climatic factors or to bacteria, viruses, allergens, and so on that have a wind heat dynamic. There may be an underlying lung qi deficiency, which makes it easier for exogenous qi to invade the body. What are its symptoms and signs? First, we have cough. There is sore throat, where the throat is red and there are possibly swollen tonsils, blocked nose or sinuses, sticky yellowish mucus, headache, sweats easily. The patient will have fever, thirst, will experience aversion to cold, though not as pronounced as it is when there is wind cold. The nose or the area around the nose may be red. The forehead may feel warm when palpated. The eyes may be red or irritated. The tongue can be slightly red in the front third and have a thin yellow coating. And the pulse is rapid superficial, especially on the right tone position. Its key symptoms are fever, aversion to cold, and a rapid superficial pulse. For its treatment principle, we have to expel wind heat, activate the wei qi, and regulate lung qi. For the choice of acupuncture points, we may choose from lung 7, Li4, Sanjiao 5, Li11, UB12, Du14, and GB20. We may use the training needling technique. We can also use vacuum cups on urinary bladder 12 or gua sha on the upper back. As for the explanations of the choice of points, lung 7 and Li4 regulates lung functions of descending and spreading. They enable wei qi and expel wind and heat. GB20, Sanjiao 5, and UB12 expel wind and activate wei qi. Lung 11 and Du14 expel heat. Here's a relevant advice. When there is an acute invasion of exogenous qi in the exterior, it is advisable to consume beverages that are cooling and spicy, such as mint, chamomile, chrysanthemum, or elderflower, to open the exterior and expel wind heat. Fasting is also advisable. Fasting temporarily means that qi will not be used to transform food and can therefore be used to combat the invading qi. Furthermore, some sources are also of the opinion that the downward movement of food and qi in the stomach created by eating food can draw the exogenous qi inwards from the surface. Similarly, the sour flavor should be avoided due to its astringent or centripetal dynamic. Vitamin C, lemon, and other things that are very sour should not be consumed during an invasion of exogenous G cold, as they will draw the pathogenic cold inwards while closing the pores in the skin, thereby preventing the cold from being expelled again. This also means that antibiotics are not recommended at this stage as they are cold and drain downward. Invasion of wind heat can be caused by lung qi deficiency, and in turn, it can result to wind heat, phlegm heat in the lung heat, yang wind heat, and Shaoyang disorders. To summarize, wind heat invading in the lung has its etiology in exposure to climatic wind and heat, and a possible weak defensive qi or weak qi. Its signs and symptoms are cough, fever, aversion to cold, scorching sore throat, stuffed nose with snivel, cough with yellow mucus, headache, body ache, slight sweating, thirst, swollen tonsils, slight aversion to cold. The pulse will be floating and rapid, and the tongue will have red sides or tip. Coating may be yellow or yellowish white and thin. The treatment principle would be to release the exterior and expel wind heat. For our acupuncture treatment, we can use lung 10 to clear lung heat, Li11 to release the exterior and clear heat, lung 11 to clear the lung heat. We can do cupping on bladder 12 to expel wind. We can also use gallbladder 20 to expel exterior wind, lung 5 to clear phlegm, Li4 to release the exterior and clear heat, stomach 44 to descend stomach qi, do 14 to clear heat, do 16 to expel exterior wind, and Sanjo 5 to expel wind and clear heat. We use, for the needling technique, we needle with drainage. For headache, we can add do 20, Taoism, and SI3. For spontaneous sweating, we can add Li4 and kidney 7. For nasal congestion without snivel, add Li20 and the extra point in tongue. For scorching sore throat, prick lung 11 to bleed. For cough with yellow phlegm, we can add bladder 13, Li4, and Li7. Thank you for listening.
Let's discuss the diagnosis according to 8 principles. The acute exterior imbalances. An acute condition will typically be an excess condition. This is because acute exterior conditions are usually due to the presence of qi. There may well be a concurrent deficient condition, for example, wei qi deficiency, in which case it will be a deficient or excess condition. The symptoms and signs in an exterior deficient condition will be milder than in an exterior excess condition. In addition to the symptoms and signs of an exterior condition being dependent on whether it is a deficient or excess condition, they will also be different if the condition is a hot or a cold condition. Etiology, invasion of exogenous evil qi. Symptoms and signs. As written above, there will be a considerable differences between the individual patterns depending on whether it is a heat or cold and deficient or excess condition. Some of the common symptoms and signs are as follows. Symptoms in the wei qi aspect, skin, muscle, joints, or tendons. When there is wind heat, there can be a fever or a sensation of fever. If there is a wind cold, there may be only a slight fever or fever sensation. there is headache, there's aversion to wind, and there is a superficial pulse. The key symptoms, there is a superficial pulse and aversion to wind and cold. We need to expel evil qi from the exterior, regulate wei qi. If there is a wei qi deficiency, you must simultaneously tonify wei qi. Acupuncture points, choose from LI4, lung 7, GB20, UB10, SI3, UB62, Sanjiao 5, DU14, DU16, UB12, and UB13. If there is heat, add LI11. If there is wei qi deficient, add lung 9, stomach 36, spleen 3. The needle technique is draining. Explanation, LI4, lung 7, Sanjiao 5, DU14, UB12, and UB13 activate wei qi and expel wind. GB20 and DU16 expels wind. SI3 and UB62 together activates wei qi and expel wind from the Taiyang aspect. LI11 expels wind, heat, stomach 36, lung 9, and spleen 3 tonify wei qi. For the relevant advice, when there is an acute invasion of exogenous evil qi in the exterior, it is advisable to consume beverages that are spicy, diaphoretic to open the exterior, and expel wei qi. This could be a ginger, garlic, whiskey, brandy, and chili, for example. If there is an invasion of exogenous wind cold, or mint, chrysanthemum, chamomile, or elderflower if there is an invasion of exogenous wind heat. Fasting is also advisable for only eating soup such as onion soup. There are two reasons for this. First, when temporarily fasting qi will not be used to transform food and therefore can be used to combat the invading evil qi. Second, some sources says that the downward movement of food and qi in the stomach can draw the exogenous evil qi inward from the surface. Similarly, the sour flavor should be avoided due to its astringent or centripetal dynamic. Vitamin C, lemon, and other things that are very sour should not be consumed during an invasion of exogenous qi cold, as they will draw the qi cold inwards while closing the pores in the skin, thereby preventing the cold from being expelled again. This also means that antibiotics are not recommended at this stage, as they are cold and drain downward. Thank you for your attention.
Pathology of depression in Chinese medicine. The Chinese term for depression is Yu. Yu is the double meaning of depression and stagnation. The simple questions in chapter 71 discusses the 5 stagnations of wood, fire, earth, metal, and water. It says, when wood stagnates, it extends. When fire stagnates, it rises. When earth stagnates, it ceases. When metal stagnates, it discharges. When water stagnates, it pours. The essential method of Dan Shi talks about 6 stagnations. That is, stagnation of qi, blood, dampness, phlegm, heat, and food. It says, when qi and blood are harmonized, no disease arises. If they stagnate, diseases arise. Many diseases are due to stagnation. Stagnation makes things accumulate so that they would like to descend but cannot. They would like to transform but cannot. Thus, the 6 stagnations come into being. Zhu Danxi formulated a prescription for these 6 stagnations called Yuezhu-1 Gardenia Chuansheng pill, which is an important formula for mental depression deriving from qi stagnation. Of the 6 stagnations mentioned, qi stagnation is the primary factor. The complete book of Qingyue gives an emotional interpretation to stagnation and talks about the 6 stagnations in a different way from Zhu Danxi, that is, stagnation of anger, pensiveness, worry, sadness, shock, and fear. This statement confirms that all emotions can lead to stagnation of qi, even those such as sadness that initially lead to depletion of qi. Cheng Qingyue said, in the sixth stagnation, stagnation is the cause of the disease. In emotional stagnation, the disease, that is the emotion, is the cause of the stagnation. So these are the six stagnations according to Chu Dan Si: qi, blood, dampness, phlegm, heat, and food. The six stagnations according to Chang Qingyue: anger, pensiveness, worry, sadness, shock, and fear. Yu as mental depression. Besides meaning stagnation, Yu also means mental depression. Some Chinese doctors say that in a broad sense, Yu indicates stagnation and is the pathological basis for very many diseases. In a narrow sense, Yu refers to the disease category of mental depression. Chinese books ascribe depression always to full causes, at least in its beginning stages, with liver qi stagnation being the main fundamental pathology underlying this disease. Other full pathologies include qi stagnation turning into heat, phlegm, and blood stasis. A heavy emphasis is laid on liver qi stagnation, at least in the beginning stages. In the later stages, the fullness can change into a deficiency, leading to empty types of mental depression. Heat can injure yin and lead to kidney yin deficiency. Phlegm can impair the function of the spleen and lead to spleen deficiency. The main empty conditions underlying depression are deficiency of blood of the spleen and heart, deficiency of qi and yin of the heart and lungs, and liver and kidney yin deficiency. Thus, in Chinese medicine, stagnation and mental depression are almost synonymous, implying that all depression is due to stagnation. This is obviously not true in practice, as there are many deficiency conditions leading to depression. However, it is true that all emotions, even those that initially deplete qi, lead to some qi stagnation. Thus, the first effect of emotional stress is some qi stagnation. When discussing qi stagnation, it is important to stress that this affects not only the liver, but also, especially in emotional stress, the heart, lungs, and spleen. In Chinese medicine, as a clinical note, stagnation and mental depression are almost synonymous, implying that all depression is, at least initially, due to stagnation. Thank you all for listening.